Good afternoon, Gothenburg. Thank you for tuning in. Appreciate everybody in the community taking time to get some tips from a generous list of panelists that are willing to take some time to share some very valuable information with our community. As a housekeeping item, last week we talked about the meeting this week potentially taking a little less time, maybe being close to half an hour. As evidenced by the list of questions that we do have this week, I feel like we may go beyond that half an hour time period. So just wanted to let everybody know that ahead of time. If you do have questions that you would like to submit during the presentation, please email those to deb@gothenburgdelivers.com. Again, that's deb@gothenburgdelivers.com with questions. One of the things that I think is important that we've talked about from time to time on these meetings is mental health. I think an important aspect of mental health, especially in these challenging and unique times, is trying to find ways to stay positive and trying to find things to be thankful for. So as I think back about the last week, I'm very thankful for the rain that we've had. Many of our ag producers were an ag community. Many of them were able to get seeds planted in the previous week, and we enjoyed nice rain over the weekend and even just a little bit since. I think it's good for me to think about spring. However, this week it looks like we don't have quite the forecast in queue for what we would have had last week, but I'm optimistic that those warmer days are ahead. I'm also thankful for some additional family time. I know we've got 4 kids at home and my wife's at home, so sometimes our house is a very active house, and those extra minutes and extra hours with kids doing family activities are cherished. And I think looking for those positives, and if you're not able to get those face-to-face, would remind everybody to leverage technology. Much as we're participating in a meeting like this today, leveraging technology, I think it's very possible to make those connections, whether it's over a phone call or utilizing FaceTime or other social media to connect with family members or friends. And I think this is a perfect time to do that, not only for yourself, but for other people. We are lucky to be in Gothenburg. Gothenburg's a great community. As evidenced, I was reminded when I read a quote today that was by a former president. The quote was, "We can't help everyone, but everyone can help someone." And I think that's perfect for what we're going through right now. And I think we all probably feel that in many ways. Again, we can't help everyone, but everyone can help someone. I found myself stranded in a parking lot in Gothenburg earlier this week. Within 10 minutes, I had 4 different people offer to stop and help. That's just the kind of community we live in, and thank you for being a part of that community. With that, we are going to begin our questions with Jeremy Eshelman from Two Rivers. Jeremy, I know there's a lot of demands on your time. Thank you for taking time to be with us today. To begin with, would just like to ask a question for those of us that might be participating in the meeting today. Can you tell us just a little bit about Two Rivers? What does Two Rivers do, and what is a health department?
Yeah, thank you, Nate. And I would echo your comments. Those were terrific comments. What a terrific community Gothenburg is. And whenever I get a chance to brag on Gothenburg, I sure like to, because as Senator Williams, I told him, I think, it's maybe been 6 months ago, hasn't Senator Williams, that my wife and I purchased some property south of Gothenburg. So we usually go through Gothenburg quite a bit, check cows in the summer times and things like that. So, but Two Rivers Public Health Department was formed in 2003 through interlocal agreement of the 7 counties that comprise Two Rivers. So from Gothenburg on the west to Shelton on the east, Ravenna on the north, to Elma and Franklin on the south. And our population base is just a little under 100,000 people. We're governed by a board of directors, a board of health that is comprised of a county commissioner or supervisor, depending upon their designation in their organization in the county, a public citizen that's appointed by that county board also. So that's about 14 people. Then there is a physician, a mid-level practitioner, a dentist, a veterinarian, and a minority health representative. So that brings our total board census up to about 19. They do meet on occasion. Usually it's about every other month or so. During these times, they've been meeting about once a month. So, but that being said, that's kind of the jurisdiction, and our work extends well beyond disease surveillance and emergency preparedness. But that's all the work we're focused on now. And I'd like to say that usually, or what we've been saying, especially to our Board of Health quite a bit, has been all non-essential programmatic areas have been deferred for this point in time just because of our response efforts. So, but nonetheless, that's probably a good baseline of Two Rivers, and we can get into the population, the demographics, if you want to, Nate. But I think that's probably a good outline of kind of Two Rivers.
Great. Well, thanks, Jeremy. Well, here we are, May 7th, and it seems like we're transitioning into those summer months. Can you give us any guidance on stuff that's normally coming down the pipeline right now? Memorial Day celebration, 4th of July, garage sales, farmers markets, any of those upcoming community events. Can you give us an idea from a medical perspective, from Two Rivers perspective, how we should be looking at planning some of those events right now?
Yeah, absolutely. So we know in the Two Rivers district at this point in time, the vast majority of our new cases have been in and around the Lexington area in Dawson County. We just did some analysis earlier today of the testing, and we're hoping to get that out via press release and our website about the percent of testing that's occurred based on population. And in Dawson County, the percent is right under 7% of our population has been tested. That's by far the most of any of our counties at this point in time. I think our lowest at this point is Harlan County, and we've been talking to a lot of citizens in Harlan County. They have no positive COVID cases at this point, but to be transparent and clear, they've only conducted 22 tests in total for the entire county. So when you look on a population base, that percent is right at 1 or maybe a little bit. No, actually, I take that back. It's about 0.6%. So very low testing as far as the entire population. So when we put a phrase in a press release out, we're very cognizant of that. And that's when we say, it really should be considered endemic across our whole district at this point in time due to limited testing. And that's one of the things we've continued to advocate for with the governor's office, the Department of Health and Human Services, to get additional testing. Unfortunately, the very best testing we have, and this is in no negative connotation towards the National Guard, but it's using National Guard and the resources to do the testing. And I say that from the fact that we've had challenges from the atypical reporting pathway that we use using the labs and things of that nature, and a lot of challenges on the public health front. But nonetheless, the things that we're constantly advocating for is getting back to our traditional pathways of testing, getting our clinicians that are leaders in our communities equipped with PPE, with testing, so we can get a lot more testing done in our communities. But that being said, there's a lot of different avenues that are developing for testing. The governor just said the other day that the CDC is sending a pretty robust response of tests at this point in time to the state that will be dispersed across our area. That's something we talked about on our unified command this afternoon. And our unified command, just to describe that just a little bit, Nate, is comprised of our health system leaders, also our local emergency managers, and we've just added a few law enforcement folks to that. And today was the first meeting we had law enforcement folks on. But a question we posed to that group was, and this is coming from the governor's office, if we have a centralized point for testing, where should that be? Knowing that we've had certain disparities in our counties as far as testing, we've seen definitely more significant disparity for our rural counties that aren't testing nearly as much. It's partly because of resources and tests and things of that nature. But it's also based on epidemiological data that we've seen more need, specifically in the Dawson area, Kearney area, and also in the Holdridge area. Surprisingly, Phelps County has the second lowest testing of all 7 counties. It's only right above Harlan County, which is interesting. And part of that comes down to our populations, the way they travel, but part of that also is a significant bias towards when we first saw an outbreak and the way it developed. We first saw that in Buffalo County, then in Dawson County, and that's kind of the testing was prioritized towards those areas from a public health response. So now as we're shifting more towards generalized testing for the population, it's important when we talk about positivity rates, and positivity rate is a term that we use in public health that talks about for every test that's done, what's the percent that will be positive. It's a good indicator based on historical tracking what your future test load will be of positive cases. And in Dawson County, specifically around Lexington, we were initially seeing about a 50% positivity rate. So for every 10 tests, we expect about 5 that would be positive. No, we definitely haven't seen that coming out of, Gothenburg Health or, necessarily COZED Community Health, but that specifically that the positivity rate was linked to the National Guard testing. It was pretty focused in and around Lexington. Now, the more typical positivity rate that we'd see on average across the state of Nebraska would be closer to 25 to 33%, in areas that are pretty hot. To give you an idea, Grand Island and Hall County, their positivity rate was really, I think it was about 45 to 50% positivity rate too. So that's to be expected to some extent. Right now, we're seeing about a 33% positivity rate with the National Guard testing that we recently conducted in Lexington. So, but Nate, to get back to your point, sorry, I didn't want to diverge too much. Just wanted to get you that information that we've been talking about. Planning for future events is definitely appropriate at this point in time. The things that we want to consider is specifically from a public health perspective, we're entering a time of high risk. As we're releasing restrictions on directed health measures, we have a great group of citizens across all of our counties. And I really believe the vast majority of citizens have abided by these measures in a lot of ways. And so as we see increased movement, there is increased risk there. We were watching as Georgia was one of the first states to release a lot of some of the stay-at-home orders and things of that nature. They did a risk analysis and just showed in the different populated areas what the risk was at this point. But specific to the summer type events, we're looking at our directed health measures in our district going through the end of May. There are conversations at this point is, from our hospital level data, from ICUs, ventilator use, it's quite possible we may be able to relax that sooner than the 31st. That's one thing we're really tracking now. The notion is the reason we want to restrict activities is so our health systems don't become overwhelmed in a lot of ways. And so we were able to do that. And so that's what we're looking at now. Is it possible we can relax that even more and earlier than the 31st? There is some discussion going on around baseball, softball, that sort of activities with some restrictions being put in place. But other things throughout the summer, large scale events for communities really should be discouraged. We're going to be at increased risk until we have some sort of pharmaceutical intervention or until time lapses and we've seen more exposures happen. That's just the nature of a pandemic like this. So.
Great. Well, thank you, Jeremy. It's certainly like drinking from a fire hose when hearing from you, and a ton of good information. A handful of additional questions for you, and this might be just to really simplify things. I think we've all seen the flattening of the curve graphic. If you were trying to articulate where we're at on that curve for Gothenburg, do you think we're still, or for Dawson County, excuse me, do you think we're moving upward? Do you feel we've apexed? If you were to parallel it to a visual, where would you say we're at?
Yeah, that's a good question. Looking at our data right now, to use that analogy, it takes 3 points to make a line. The same could be said about determining when a climax is. You have to be past it to know you're there. And so I really believe, looking at our data, we're really close to that point if we haven't climaxed already. Just looking at the data that we see coming in. What we have seen from our testing results has been a lower median age of positive COVID-19 individuals. And part of that you have to understand the population that we've tested, specifically in and around Lexington, has been a fairly low median age population. And so that being said, as we do more of a generalized testing, we get a better idea of what's out there as far as asymptomatic folks. But I think right now, if I answer your question really honestly and to the best of my ability, is I really believe we've climaxed and we're probably coming down at this point.
Great. I feel like that's good news. You touched on this briefly in your earlier comments, but just to really focus on it, how do you feel Gothenburg and the area hospitals are keeping up, with our infrastructure, keeping up with patient demand or medical demand?
I really refer that to Mick. He's probably in the best position, but I think the information we've seen coming out of, we call the essential elements information that our facilitator for Tremors, the Tri-State Medical Response System. We're fortunate to have that individual as part of our team, and he actually oversees all those activities around hospital preparedness for the 4-district area, including Grand Island, Hastings, Kearney, and even to the north. And so part of the information that he's pulled has showed that decreased activity, in and around our systems. And I know North Platte, the hospital where we see a lot of transfers to, in addition to some of the Kearney hospitals, the Grand Island hospitals, are all seeing decreased activity. It by no means it indicates that they are empty, but what we are seeing is definitely more of a consistent decrease in the percent of the patients that are on ventilators, a decrease in their census of COVID positive patients also.
And I think one of the logical things to explain that is we're at a little bit of a lag time from what we've seen on the coast, or certainly other areas of the country. So that bought us a little bit more time to get prepared. But then as we start to see some restrictions lifted in other parts of the country, what could we expect here as compared to many other parts of the country?
One thing I've said for quite a while, Nate, is I think living in Nebraska, we really understand social distancing better than a lot of other folks do. So I'll give you an example of my parents. They live up in Wheeler County, Nebraska. And I told them, I said, hey, you guys are social distancing already. You go to town once a month, just keep doing what you're doing. But, I think a couple of things we have going for us as far as characteristics of our population. One, I really truly believe folks in Nebraska are good people, and they follow rules a lot better than some other parts of the United States. And that, I think that's a real significant benefit for us. In addition to what we all see, and we see this in Gothenburg as much as any other places of the district, is our communities pull together. And that's one thing we've said for quite a while is the more conscious our communities are that this will be a community by community perspective, the better our health outcomes will be. And so as we consider that, I know there's been a few instances over this last week where Gothenburg's really shined, from the, different daycare examples and exposures and things like that. It's been just really interesting to see how the process unfolds. And those things are pretty tremendous because they've helped us in a lot of ways on the front lines too, as we work through contact exposures and in addition to finding daycare and things like that.
Yeah, great. As we start to see some of the restrictions lifted, one tangible example would be church services that was relaxed by the governor earlier this week. Is there any deviation from that statewide guidance as it would pertain to Dawson County?
There is not any deviation from that. That's an entire statewide relaxation, and there's two sides to that. One, I think personally, there's a certain behavioral health, a faith-based piece that I think all of our population really needs more now than probably ever. And I think that was a wise move in that regard. Now, that being said, from a pure public health standpoint, there's challenges whenever you allow people to start congregating again. And some of the things that were the guidance that was discussed as far as making sure household units stay together, they're spaced out, there's a passing of items among the congregates, things of that nature. I think those are really great ideas. Some of the concerns we have, and I should also say, Nate, those should be considered minimum guidelines. When we talk about directed health measures, if a community wants to be more proactive, those would be things that we definitely would support. And also we need to be cognizant that as much as we can, these are times of high personal responsibility. If somebody is at high risk, they shouldn't be going to church. They shouldn't be going out in the community more than they absolutely need to. So, but that being said, there's some guidance out there around these events. Where we see more concern at is when we get into the ceremonies piece, because they're ceremonies for, like, we consider weddings, funerals, things of that nature. The very nature of human behavior is, if we have a funeral, and I know we saw a Dawson County citizen just this last week that unfortunately passed away. That was of a younger age. It becomes challenging to restrict movement because we're social creatures by the very nature of what we do. And so trying to make sure people are spaced out and, we avoid that contact can be really challenging.
Yep. But thanks, Jeremy. And you did bring up a younger person within our county that did pass away as a result of COVID. And unless we've had an individual connection to someone with COVID, that really brought it home to me that somebody in their 20s died with complications associated with COVID. Is there anything you can share about any underlying medical issues or any other details about that situation?
I can't comment anymore on that right now, Nate, but what I can tell you is our statewide average for mortality related to COVID-19 is about 1.4% per 100,000 people. And knowing that our population for our district approximates 100,000, that would put us around like one or two people. And right now we're up to 4 people. And part of that increased death is attributed to increased prevalence, specifically in Dawson County. And we see like in our neighbors to the east in Hall County, I believe they've exceeded 35 people at this point in time. And it's hard to, I made one of the first calls when we had our first resident that had passed away from COVID-19. And we talk about the economics, we talk about the math. At the end of the day, people are people. And whether it's one person we lose or 4, it's still hard in a lot of ways. And if that person is one of your loved ones or family members, it doesn't make it any easier necessarily. But at the end of the day, I think this is a lot of uncharted waters for all of us, and we really need to think about what's best for our communities.
Yep. Jeremy, along those lines, what if someone is supposed to be self-quarantining and social distancing, but they're not adhering to that guidance? Is there, as a concerned citizen, is there something we should do with that information, or what do we do if we find ourselves observing a situation such as that?
Yeah, thank you, Nate. That's a great question also. You guys have some terrific questions. I really appreciate these. So we actually have had a couple situations like this. Some businesses that have been non-compliant. We've also had some individuals that have chosen to do their own thing. And I really think those are more the unusual circumstances than the normal situation in a lot of ways. And there again, coming back to that point I made earlier, that a lot of people who live in our area are really great people that want to follow the rules. But occasionally, we have people that don't, and that's why you have rules in a lot of ways. So one individual that I just want to reference, and without speaking about a specific county, but let me say it was in Dawson County, if that's fair, that we had a challenge in. And it was an individual that we knew that should have been home isolating. She was sick. She was reported to be a local gas station, and that was reported to local law enforcement. So they called us and we had a conversation with them. We looked up the history and partnership with them. We talked to the county attorney and really put it in as things should be, when it comes to enforcement and citations and things of that nature. The typical reporting pathway is to law enforcement. They investigate it. If they find cause, they ticket a person. And then it comes to the county attorney if they want to prosecute or not. And that's exactly what happened in this case. Now, I can't tell you the outcome because this just happened yesterday. So we're still waiting to see what will happen with that. But that really becomes a county decision as far as if they want to enforce that or not. We really feel, and this is something I'm to talk to on behalf of the Board of Health that I've been talked to about this, is our role really is to promote regulation and promote overall wellness, and it comes to a community by community decision on how that should be enforced.
Great. Thank you, Jeremy. Appreciate your insights there. When it comes to specific occupations, maybe as going to get a haircut or a dental appointment, I think there's some guidance at a statewide level. Is there going to be any deviation from the statewide guidance at a public health district level?
At this point, Nate, I don't believe so. And it's a challenging time for sure from a lot of perspectives. If we look at elective medical and dental procedures, there again, that was something that was relaxed on May 4th. It's a double-edged sword in a lot of ways. We know people, there's an access to care issue, and we never would want to portray ourselves as we know what's best as far as a certain situation. That really comes down to an individual provider. And I'm going to step over the side here a little bit so I'm not the sun. Sorry about that. I didn't realize that until just now. I really don't like being in the limelight any more than I need to, Nate. So, when it comes to an individual medical decision, that's something we really deem that a healthcare provider, whether it's a dentist, a physician, they're in the best position to make those decisions themselves. And when it comes to elective procedures, who am I to say that somebody doesn't need a hip replaced and it's an emergency and it's critical versus something that can be planned out? And so that really was left to the decision of individual providers for the most part. I just had a story I'll tell really quick, Nate, I promise I'll be long. I just texted somebody I hadn't talked to for quite a while, and they live about 15 miles away from me, and just asked how it's going. And they said, well, not very good. Just went to the dentist today, had a couple of teeth extracted. I'm like, wow, that's terrible. Well, this is the first time they could get in. So just as much as we're trying to protect our healthcare providers, trying to protect our population, there's also an access to care issue. And it definitely is one of those things that we'll have to work through. It becomes a kind of a challenge on that side.
Great. A question that we received from the queue, can we get tested anywhere in Dawson County that wouldn't be going through a medical provider? So say I'm asymptomatic, I don't have any symptoms, but boy, I'm curious. Is there any tests available that would, for somebody in that situation?
The best way I can answer that is we've been advocating strenuously to get additional testing across all of our communities at this point. There's a couple different avenues. You can take the assessment that's through testnebraska.com. That's a contracted testing through the state of Nebraska, through the firm out of Utah. And if you, based on your answers, if you're considered a high, medium risk, then you would qualify for a test. The challenge with that right now is only two. Actually, I think today they opened up another site so there's 3 locations in Nebraska. You'd have to drive to Grand Island, Lincoln, or Omaha at this point. And I believe they're planning to open up 2 or 3 additional tests at this point. What the governor's office has told me is that I don't believe any of those will be in our district. Maybe North Platte might be the closest location for us. Unfortunately, but that's something we've been advocating for. So that's one option. The second option, and this is something we talked about in Unified Command earlier today, was establishing a location in our district, a centralized location where people can drive to and more of a generalized test. It can be general public, something of that nature. And honestly, we need to keep in the back of our minds the best time to get tested, because this really is a point in time DNA test. So if you are symptomatic with COVID-like symptoms, and you truly believe this could be COVID, that would be the best time to get tested. If you feel generally pretty well, it doesn't in any way determine immunity, it doesn't determine exposure history. So it is just that point in time. And the analogy I use, there's probably a few people on our call today that know what a 35 millimeter camera is, but it's like taking a picture, with your camera. It's for that specific period in time only. Unfortunately, and there are additional tests that are coming down the pipeline at this point. I've heard a few out there of the finger stick serology type tests, like the Abbott machines and things like that will help us understand a little bit better as far as, has somebody been exposed, or is this an active exposure? The challenge with that is there is a high error rate with those. And so we do have other tests like that in public health for tuberculosis, for HIV, things of that nature, and they're not perfect, but it's a good screening tool nonetheless.
Great. Well, thank you, Jeremy. And one last question from the queue. You had talked about our medical community having a pretty robust supply of PPE equipment. If a consumer not associated with the medical community was looking to acquire some PPE, face masks, gloves, anything of that nature, can you give us a good idea where we could source some of that protective gear?
It's a challenging time for PPE right now, honestly. I know the state of Nebraska was really wise, and when they first saw this rolling downhill, to aggregate a lot of the orders to use purchasing power of the state of Nebraska to acquire supplies. At this point in time, there's a website that individuals can log on to, but I can tell you, at least right now, all the resources are going to the front lines. So like healthcare providers, EMS are really being prioritized. Long-term care is being prioritized. So when it gets down to the point of general consumer, at this point, there's no leftover PPE that can be acquired that way. So other suggestions that I know that came out from a lot of our other communities have around face masks, and also aprons or gowns, as we call that, would be more of cloth sewn, things of that nature. And those, we see a lot of community members that are putting those together. We know the efficacy isn't nearly as well, it's like an N95 respirator, but nonetheless, it's still some protection. And yet when we wear a mask, we're protecting basically you from me in a lot of ways. So if I'm wearing a mask, I'm protecting you from me, so, and vice versa. So as long as we keep that in mind, in addition, the social distancing of 6 feet or more is so critical. So things like that just make such a big difference. But unfortunately, the very reality of our supply chain PPE, it's getting better, but we're not to the point yet that I think individuals will be able to go onto Amazon and get supplies. Now, there are some things that become readily available, like hand sanitizer. We've seen a lot of our local ethanol plants provide some hand sanitizer of sorts. That's been a great option. We've also seen some local manufacturers create some pathways through 3D printing and things of that nature for different supplies. So I would encourage everyone to, from an innovative standpoint, to think, how can we meet some of those needs on a local basis? Are there things that we can repurpose, retool at this point to provide those needed necessities in local communities?
Great. Well, thank you, Jeremy. Really appreciate your insights, and thanks for taking time out of your schedule to share with us. Thanks for all the great information. We're going to transition now to Dr. Shackleton. So Dr. Shackleton as well, thank you for taking time to be with us today. Some of the questions that were submitted that we wanted to ask some of our local providers. One I thought was really interesting: is there any correlation between blood type and the effect that the virus has on a person?
Thanks, Nate. That was a really interesting question. The first time I heard that, I thought, my goodness, people are way out there. But interestingly, there was a study in China that showed that a slight increase of COVID incidence in people who are blood type A and a slight decrease in people who are blood type O. Now you have to realize that the studies are small. It was replicated in New York, but in that study, it was only for those people who were A positive that seemed to get higher doses or higher incidence of COVID, and the Rh negative people did not. Given that, age and genetics are not something you can fix. Diabetes, heart disease, smoking, high blood pressure, obesity, those are risk factors that we personally have a little more control over. So yes, while the blood test might be related a little bit, you've got what you got.
Yep, good. Thank you, Carol. And face masks, they are terribly stylish. And
Oh, they are.
Seeing more and
Mine's
more
yellow.
of them, it seems like, yeah. I feel fine. Why do I have to wear a mask?
Jeremy touched on this briefly when he talked about protecting you from me. It's a matter of source control versus personal protection. We know that face masks are okay for preventing the virus from getting into your system, but there's lots of other ways to do it. So initially, we didn't have people wear face masks routinely because they're okay, they're not great. But what we've discovered more is that there's a lot of people out there that are minimally symptomatic or asymptomatic that think what their symptoms are just allergies, when maybe in fact it could be COVID. But the face mask is really, really helpful to keep those secretions and those little droplets and things contained within that person. Okay, this one shows you basically. So if neither person is wearing a face mask and they cough, of course, this is a different example, I'm going to get sick if you cough on me, or I have a high probability of it. If I'm wearing a face mask, then some of it might get through, but I do have some protection. On the other hand, if you, as the asymptomatic person, is wearing protection, I'm okay, particularly if I have a face mask in addition. So the face masks are really useful for those people who are asymptomatic to prevent it from spreading to others. And the thing is, we don't know who's asymptomatic. We're estimating there's 25% of the population that's already been infected, and we don't know who it is, and you don't know who it is, and you don't know if it's you. And so you go ahead and you use the face mask to protect your neighbor, your family, your grandparents, the person down the street that has cancer, the person in the grocery store. You're doing a community service by wearing that face mask. You're helping your community, and that's why it's so important.
I know that's helped me as I feel a little awkward when I'm wearing my face mask out in public. It does feel a little bit weird, but if in the back of my mind I can know that I'm actually helping somebody else, that makes that little burden just a little easier to bear. So thanks for a entertaining graphic on how that can be beneficial to other people. One of the things that I think is really interesting, and this was a fun question to think about, be interested to hear your answer. Our immune systems tend to build up over time by limited exposures to different things. What do you think the impact of us sheltering and this physical distancing will be on our overall immune system?
There was a video that went viral on the internet that has since been taken down because of the inadequacies, let's say, of the study. It is true, we build immunity from day one by interacting with our environment. Every time we get an immunization or the kids bring home something from school and we get the cough and cold, it works to stimulate our immune system. The pretense of that one video was that by sheltering at home, we are not having that interaction, and that is just entirely false. There is no way that you can sanitize your home to the point that you are in a sterile bubble. So you will continue to interact with your environment. You will continue when you go to the grocery store, or drive the car, or go to a business, you will continue to touch things. You will continue to interact with those things. And we are going to see the COVID virus spread throughout the community. It's not that's not going to happen. What we're trying to do is to slow this contact down, more like an immunization series. You get a little bit here, a little bit there. We don't want to just blast everybody with a huge dose all at once for a number of reasons. The illness itself can be very prolonged. One of the fallacies on that video was that the fatality rate was no greater than with influenza. Well, A, we don't know that yet, and B, people get really, really sick for a long time with this stuff. They can be on a ventilator for a couple weeks. Whereas with influenza, yeah, they might get sick for a while, but most people do well. So we're not going to stop this from spreading. What we're trying to do is slow it down enough so that we don't overwhelm our healthcare systems with 25 people on a ventilator when you only have 10 to go around. The immune system is an amazing, amazing process, and it will develop antibodies, and there will be a lot of people that will be exposed and develop antibodies and maybe have a mild case. And eventually we will develop what we call herd immunity, where there's so many people that have antibodies on board that the chance of spreading will be fairly small. But to get to that point, we have to have probably 90% of the population already infected. And at best, we're at 25% now. And that's just basing on, some counties have 0% positivity rate. We have 40, take the average, we're at 25. So, and 25% asymptomatic. So, we've got a long way to go.
Yep, perfect. So talking about some of those immunities, and one of the things that is talked about is a vaccine or a potential vaccine, and hopefully something like that will be part of our reality in the near future. A question that we've received is, what about the flu vaccine? By having the flu vaccine, does that elevate my risk level of contracting COVID-19?
No. There are some studies out there that have hinted at that, but there really is no evidence to support it. The studies that are there are weak and inconclusive and have contradictory results. One of the things that's very confusing is on these studies, they talk about viral interference, and people understand that to mean that it's interfering with your immunity and you're going to get a super infection. What it actually means is that the virus that is in the flu vaccine is interfering with the other vaccine that would give you a super infection, so it would actually be protective to get the flu vaccine. So no, do not hesitate to get the flu vaccine. The combination of flu and COVID is much worse than either one alone, and it's important to get your flu vaccine.
Perfect. And what is the accuracy of the COVID testing, do you think?
It depends on which test you're looking at. The nasal swab that we're using is in the lab 100% accurate for detecting COVID virus. That's in the lab. The problem is the sample collection, the handling of the specimen, the timing. If you get it, too early or too late in the course of the disease, you might not get enough in the sample to really give an accurate test. They have estimates of up to a 30% false negative rate. I personally don't think it's quite that high. And if you've had the testing for that at all, you know that 10 seconds with that swab all the way up your nose is no fun. And it makes it a little more difficult. But that particular test done correctly is highly accurate. The antibody test that they're talking about, which is new, it's at this point fairly unreliable because the FDA has not approved many of the tests, and we don't know if the antibodies levels at this point are sufficient to prevent reinfection by the virus. And of course, the virus can always mutate, and then it really wouldn't make much difference. So we think at that point, there's a false sense of security out there, even if you do get it. And the very new one is the antigen test, which actually tests for some of the proteins on the virus. That's currently under research, and again, has real variable reliability and specificity. That one's more like a strep screen, which can be pretty accurate, or a flu or mono test, which are maybe less accurate. Some of the quick finger stick tests that we have seen come out have a 15% false negative rate under lab conditions, under perfect conditions. So at this point, the best thing is the PCR, the nasal swab.
Great. Thank you, Dr. Shackleton. And one question from the queue. Is there a risk of elevated CO2 exposure while wearing a mask?
Most of the masks actually have decent air intake. There's filtering mechanisms within the mask itself. And unless you're wearing an N95, we all have noticed that when we have this on, you'll get a little sucking in and you'll get puffing out. And those of us who wear glasses notice that the glasses will fog if we don't have it on there properly. That all tells me that you've got lots of air exchange, even with the mask. So CO2 should not be a problem.
Yep.
The N95s are a lot tighter, but even those are designed that you can breathe properly.
Perfect. Well, thank you for all of your service to Gothenburg, and thanks for taking time to walk us through a number of those questions. Really appreciate it, Dr. Shackleton.
Yeah.
Mick, CEO of Gothenburg Health, we've got you up next. When do you expect to see elective surgical procedures start back up again?
Yeah, that's a good question, Nate. So as Jeremy was telling us, that the state kind of released those directed health measures to allow hospitals to start doing elective procedures just on May 4th, so this week. We've decided to be a little bit more cautious, given the fact that we're kind of in a bit of a hotspot right now. So we're working to plan our ramp up next week with our intent to start doing more elective type surgeries and other procedures starting on May 18th. So don't want to confuse that with we're closed. We're still open. We're still seeing patients. We're still seeing people for whatever they need to, but we're going to start to relax those standards, continue to protect people, screen people at the door, no visitors, that sort of thing, but be able to start doing some of those more elective type of procedures. And we're going to start with the more lower risk procedures, but we're kind of on pace for colonoscopies, things like that for that first week, and then moving into more orthopedic procedures, and then potentially starting back up the joint replacements and things like that in June. It's kind of is sort of our plan at this point. And that, once again, can vary depending upon how things are going, in the rest of the county. At this point in time, we have not had, knock on wood, a single inpatient COVID patient that we've had. We've had some people that have tested here that were mildly symptomatic and quarantined at home. We're unique among the 3 hospitals in Dawson County in that we have had no inpatient COVID-19s. If that holds, then we feel pretty safe that we can start to do more procedures. If that were to change in the next couple of weeks and we started to see a lot of inpatients or some inpatients, then we may reconsider that despite the directed health measures being lifted.
Great. Thanks, Mick. This next question, we're just living in kind of uncharted times right now. And in many settings, this would seem like a rude or a breach of etiquette question, but I'm going to go ahead and ask it anyway because of the times we're in right now. I've heard there's been some cases of employees at the hospital that have tested for COVID. I don't know if you can speak to that. Is the hospital safe for me to come to if I need something, if I need to come into the ER? It feels awkward asking those questions right now, but because it's important to all of us, I'm going to go ahead and ask you anyway.
Yeah, obviously I'm not going to talk about the who's and the what's, but yeah, we have had some positive, some employees that have tested positive. None of those employees are, any of our frontline employees, and we've determined that the exposures have all been community acquired. So they haven't, the few that have gotten, that have tested positive, have not gotten it here at the hospital. So I think that probably as a result of that situation where we've had a couple of employees that tested positive, we're probably one of the safest places in town now because of that, we sent a whole herd of people to the National Guard testing, and most everybody came back negative. I was one of those that was exposed and went to Lexington and got the nasal swab, and I was negative as well. But the folks that have been positive, they've gotten it, just being out and about, and they don't really know exactly where, but none of them are related to direct healthcare provision. So none of our caregivers most of them have been tested, and none of them have developed COVID. So I would say that we're probably one of the safest places to be right now, because as Jeremy said, it's a point in time, right? And as of this point in time, we've had about 30 to 40% of our staff have been tested because of the few positives that we had and potential exposure to those people, and they've all come back negative. So we're kind of in a unique situation in that we know, at least at this point in time, that we don't have a lot of positives running around, and the ones that we know that are positive, they're quarantining at home.
Yep. And really, the medical community would be best positioned to know how to behave in a way that would stop the spread within an organization. I find myself trying to remember to not touch my face, not put a pen in my mouth, try to wash my hands frequently. And that's not part of my day-to-day routine like it would be for those medical practitioners. That's really second nature to that group.
Yeah, and that is true. When when we learned of the first case that we knew that we had internally, we immediately sent people out for testing. I think another question that you were going to ask is about the YMCA daycare. Over really an abundance of caution, the YMCA was taking care of hospital staff kids. That has been shut down for the 2-week kind of quarantine period. They're going to start back up doing that May 18th, but we wanted to make sure that we weren't infecting everybody else through those kids. And so we really responded very aggressively and very rapidly to make sure that we didn't see a major spread among the hospital staff and hospital staff families.
Great. Well, thank you, Mick, for having and executing on a great game plan that really does benefit our entire community. Thank you. Next, we're going to go to Dr. Rhodes, and Dr. Rhodes is not a medical doctor, so it's our Gothenburg Public Schools superintendent. So thank you for taking time to join us today. Question: is there any plans for summer school?
Yeah, thanks, Nate. And I did not stay at a Holiday Inn Express last night either. So yeah, we are planning summer school. We're going to have summer school. As of right now, it most likely will look like our current remote learning system that we have in place due to the physical closure. Now that could certainly change based on any loosening of restrictions that may come out after May 31st. But as of right now, our teachers that have taught summer school in the past are planning and prepping to teach summer school.
Great. Okay. And then I guess the next logical question, what about the start of the school year 2021 next August? Any thoughts there to share with us?
Yeah, that's a great question. We have already started to prepare for the start of the 2021 school year. Administration and teachers are building currently what we're calling a transition plan. We're trying to identify essential concepts and skills that maybe have not been taught and learned due to the nature of remote learning and not being in a physical setting. We're calling that unfinished learning. And so from a curriculum standpoint, we're trying to identify those different bits and pieces that we're going to have to teach maybe for the first time that would have been taught at the end of the school year. And the other part of opening up the school year is the plan will be multifaceted, and it'll run the gamut from a regular opening on August 14th all the way on the other end of things that would be a remote learning type of situation that we're currently in. And so again, a lot of that will be predicated on what we hear from the governor and again, the DHMs that come out and whether we can have 900 kids in this building or not.
Great. And I know you guys have been doing a great job communicating with the parents and families through the teleconnect and through emails, but maybe for some community members that wouldn't be in those normal communication channels. Normally right now we'd be having honors night and spring activities banquet and cheerleader tryouts, some of those placeholders on the school calendar. Can you just give an update on some of those different activities and what we could expect?
Yeah, those are absolutely great questions. And of course, those capstone events are certainly, they weigh on our shoulders just as much as our kids and our families and honoring our kids. In terms of honors night, the high school office will be putting together and compiling their honor awards and certificates. They will do that Monday. We will mail those out to students probably late next week. We will also utilize both papers, the Gothenburg Times and the Gothenburg Leader, which have been great partners with the school district and with the community of Gothenburg to help communicate as well. And we want to honor our kids in that fashion. And then we're looking at the possibility of utilizing some social media as it relates to honors as well. Spring activities banquet right now, Mr. Moracek will be putting together the winter and spring letter awards as well as any other awards that goes with those activities. Those will be mailed out towards the end of the month. Our 12 sport participant awards that are a great honor here at Gothenburg Public Schools. Those plaques will be delivered by Mr. Moracek to those seniors who have earned that accolade.
Great, thank you. One of the things that has been a very visible presence in the community is the meals that the school is providing to many of the patrons of the district. Can you give us an update on the meal program?
Yeah, originally the meal program was going to end on May 15th when the school year ended. As of right now, we have been granted the summer meal program waiver to provide full reimbursement to the school from the federal government. So we will be serving free meals to students birth to 18 through June 30th, and that will begin on May 18th. We currently are developing a different registration form for those meals. We will put those in the sack lunches that go home with the students. We will have hard copies of those here at the school. We will put those in print at both the Times and the Leader, and the form will also be on our website as well. And again, that is free for everyone. And again, we've talked in past town hall meetings. There is no stigma with that. And we would just offer any of our, again, birth to 18-year-old kids to take advantage of that program.
Great. Thanks, Dr. Rhodes. And one last question for you. This could have come straight from the Wyatt household. I have school library books at my house. How do I get those returned to the school? If my student has items still on campus, how do I retrieve those items as we're approaching the end of the school year? What's next?
Yeah, again, that's another great question as well. We set up a couple different times, both Dudley Elementary and also junior senior high, for library books to be checked in. And we understand that was pretty short calendar windows to get those things done. The best advice we can give parents and students, if they have library books to be turned in, or if they have items still here at school, make contact with the building principal. They will set up an individual appointment for that student to come in, get the items out of their locker, and turn in a library book. Now, in terms of our underclassmen, junior and senior high, we are going to do a drop-off on the 18th, 19th, and 20th of May in the afternoon. It'll be just a drive-through, and it'll be a textbook drop-off. They certainly could drop off their library books at that time as well. And as we develop these on-the-fly programs, we've used a phrase with our staff as we've kind of gone through this, and we really are building the boat as we're sailing. And so there just are a lot of things that come up that sometimes we haven't looked into the future to see. So as we navigate where we are presently, there's a lot of navigating to do in the future as well.
Great. Well, thank you, Dr. Rhodes. Really appreciate the updates. Next, we're going to go to Gary Greer. Gary is our city administrator. And Gary, a question for you. Do you think the city will see significant shortfalls in revenue due to the directed health measures?
Currently, we're doing a lot of analysis on that. That's first rate in my mind right now. And I guess I wouldn't categorize significant shortfalls. We will see shortfalls, but years and years of conservative budgeting by the mayor and council that put us in a position where I think we can manage it. And I think we're going to be okay. That's unless we have a real curveball from the federal state government. But fairly much we have stable revenues. And our first 6 months of our budget year were strong. So we're hoping we can weather the storm and we won't have any problems and service delivery won't be disrupted.
Great. Thank you. When do you think City Hall will be open back up to the public?
What I'm planning in my mind, and I hope the governor is with me on this, is I hope to have City Hall opened up in June at some point in time. The directed measures will be following those verbatim to keep everybody safe. But I would really like to see that happen in June. We're missing our citizens, the people we serve, and I really hope we can get back to business here in June.
Yep, perfect. And maybe even on the lighter side, what about the swimming pool? That's a fun place to see people gather in the summertime. Any thoughts?
Actually, that's not very light. We did everything we could do to try to make the swimming pool open, but looking at it, and the reality is we are not going to open the swimming pool this year. So I'm encouraging everybody to buy hoses so we can get sales tax, and we can get out in the yard and get some water that way, because the pool will not be open. It's a situation where we couldn't manage it, and most cities you're going to find are doing the same thing. So I'm a bearer of bad news, but I'm a bearer of safe news.
very similar to wearing masks, and that if we know the reasons why behind why we're doing those things, it makes it a little easier to comply with. So yeah, we're all forced to make some of those tough decisions, but thank you for making that for the safety of our entire community. So thanks, Gary.
you,
Next,
Nate.
we've got Pastor Jamie with us. Pastor Jamie is here representing the Ministerial Association. Are you aware of any congregations that will gather this coming weekend with the new guidance from the directed health measures from the governor's office?
I am not aware of any that are planning on it this weekend. I think that there are some that are having more serious conversations about it for the following Sunday. I know that my congregation and a couple of others that are connected with larger denominations have some pretty strict guidelines that they're talking about. Particularly, and one that I'm struggling the most with is the danger of singing together. When we sing, we tend to express a whole lot more, and so you need to even be further apart than 6 to 10 feet when you're singing, and I have a hard time imagining worship without much singing. So we're having some pretty serious conversations about what it means. Do we put plastic on our pews so that those can be cleaned a little bit easier because the cloth can't be cared for? Do we take all the hymnals and Bibles out, or do we just clean them after every service? So there's a lot of serious conversations taking place of how we can keep our congregation safe, because if our congregation is not safe, then our whole community is not safe. So there's some very serious conversations that are taking place, and all of our congregations are having those, and we may come out with some slightly different understandings of how we approach that. But as far as I know, no one's planning on starting up this Sunday, which is a real struggle. It's a big Sunday to miss.
Yeah, but I think most, if not all, of the congregations have a virtual experience available, and that's really good news, and we can celebrate that way. So
we can, and many of us are planning on, even when we do come back together, continuing that virtual gathering so that we can continue to care for those who can't come, or who are still not, even when we can come back together, are still not in a good place to do so.
well, my family may ask that I not sing in the living room when we're having those Sunday services. One last question for you, Pastor Jamie. Give us just an update on the food pantry, if you could. That's been a great source for many in the community. I know there's some concern once school lunch program closes, that we could see some elevated needs there.
Yeah, at the moment, we're still doing quite well with the food pantry. People have been generous. They continue to drop things off. And I would just remind people that it is in the alleyway behind the American Lutheran Church, those glass doors that are there. If you would just drop off items and put them in the food basket that's there, that way it keeps everybody kind of safe, and we can make sure that we put those in the baskets. But at the moment, we're doing quite well. After we stop being able to count on the schools helping feed people, then later this summer, I think we could see perhaps a little bit of a drain on that.
Great, thank you. Thank you for taking time to spend with us this afternoon.
My
I'm gonna switch over to Colton with an early childhood update. Where can people find resources if financial instability is something that's their family's experiencing? Do you have anything you can share with us that would be helpful to some of those families in need, Colton?
Sure, Nate. First off, I'm representing early childhood and the Gothenburg Early Childhood Learning Coalition. So us talking about finances, I can see it may throw people off a little bit, but one of our missions and one of our big projects in the community is to help with overall community well-being. So part of that is financial well-being of family members. And so I encourage people to go to geclc.org. We have links to resources for families with questions on finances and maybe with a need for assistance. So again, if you go to our website, we've got some great links to different resources that families can take advantage of.
Great. And can you tell us the source of some of the resources, Colton?
Sure. So we do have a partnership with the Nebraska Children and Families Foundation. and I'll get to that in a second with part of that piece, but also in partnership with Flatwater Bank and our local banks, we have some great resources. So again, you'll find those links on our website, and you'll be able to take advantage of those. So.
Great. Thank you.
And I will say, Nate, another piece, like I said, I talked about Nebraska Children and Families Foundation and this community well-being efforts that we're undergoing in Gothenburg. And we're happy to say that they've provided us some funds to distribute to the community. And so we have $4,000 that are coming through the GECLC. We're passing through to the Senior Center and to the food pantry. To provide some staple food items to seniors here in the community. And I'm also happy to say we're hearing that that's just the front end of those donations. And so we hope to be able to continue to contribute those funds to some of our local folks in our highest need areas. And right now we're seeing that being food. So.
Great. Thank you, Colton. And the last two participants or panelists we have today are both from the state level. We have Sean Kashke with us. He's our UNL Extension agent. And Sean, I know we're running tight on time, and I apologize for that, but any real highlights that you want to share with the group today?
Thanks, Nate. Again, my name is Sean Kashke with the University Extension Service. And there was a question asked about the effects of the business community with the C-19. And I'll have Will on the share screen throw up a quick chart that was shared by someone, an economist from the Kauffman Foundation. And, you know, one particular thing there, the second bubble, it's kind of hard to see. You might have to zoom in, but the hog market, and this is already 3 weeks old, is 50% less than it was a year ago from this time. So definitely some big impacts there. The University of Nebraska Bureau of Business Research, if you just Googled that, UNL BBR, you can see just today there was some updated statistics. You know, things are kind of grim, as you might suspect, with the unemployment expected to drop, between 2 and 3%, farm income down almost 23%. But please go ahead and Google that for more details. I won't go through all of that. The ag sector, be impacted, of course, manufacturing between 2 and 3% for the year. So please just Google search UNL BBR to get all of those pieces of information. And there was another question about state and federal funding, and Senator Williams on the line might have some better ideas at the state level about legislation, but the federal level, folks should still apply for those CARES Act programs, as you know, Congress is working on debating different things, and so it's better you apply and get rejected and not to have been late in the queue. So that's what I have today. Thank you, Nate.
Thank you, Sean, and we'll make sure to get additional resources out in that email distribution list. So Senator Williams, you know me about as well as anybody would on the panel, and you are probably not surprised that I said it may take half an hour, and it took an hour. So Senator Williams, any closing comments for us?
Well, I thought maybe you just misspoke, Nate. No, a couple of things, and very quickly, I appreciated the conversation with Jeremy Eshelman of Two Rivers today. Many of us didn't even really know what Two Rivers was until we've become more involved with it. They are a great resource, and they're working tirelessly right now. They do lots of programs, but right now, every one of their people is devoted 100% to the COVID issue. Jamie talked about the church situation. I would encourage those that churches should be open sooner than later to read the guidance that's sent out. I did have my office mail that to all the churches in my legislative district this week. The guidance is very straightforward and very difficult to fully follow. And so the protection of our people is very important, and many of our congregations are full of elderly people that are more vulnerable, so I don't push too hard on that. You've heard a lot about unemployment insurance, people applying for unemployment insurance and the delay in getting that. Again, when you can imagine that we're having 3 to 4 times the number of claims sent in. I did find out today we had 6 potential people that had contacted my office. We contacted the Department of Labor today. All of those are now being fulfilled. So most of the time, it's not that claims are being denied, it's a delay in getting them processed and the money out. Also, the election is next week, May 12th, next Tuesday. And if you haven't done your mail ahead, you're too late now. But hopefully we will be having the 2 polls in Gothenburg. We'll have a polling place at the Methodist Church and a polling place at the American Lutheran Church on Tuesday. We still are looking for a few more volunteers to man the polls. We're close to having enough, but if you are interested or know somebody that is, have them contact me. And you did hear the Paycheck Protection Program that is out there that our banks are working very closely with. There is still money available in the second round of that. So I would encourage people, if you haven't followed through on that, do it. We have experts in the banks that can manage you through that and navigate you through it and find out if you do qualify. With that, Nate, I would just continue to encourage people. This is a marathon, not a sprint. Don't get tired at the end of the race, and don't relax and continue following the rules because it makes a difference.
Great. And again, a special thank you to all the panelists that I know have significant demands on your time. Thanks for taking the time to spend with the community. And a big thank you to all the participants that have chosen to take the time to educate themselves. As we go through these challenging times, I really do believe education is empowerment. And an ask that we have had before, if you could please take time to share some of the things that you've learned today with members of your family, members of your community, people in your social circle that may not have had the same level of access to this information. Thank you very much. We'll see you next week.